Welcome to our presentation regarding the proposed research study called Control of Major Bleeding After Trauma, or COMBAT. Dr. Ernest Moore is the principal investigator in charge of the project. As you proceed through these slides, please click on the speaker icon for the audio. The proposed research study is sponsored by the DoD's Telemedicine and Advanced Technology Research Center to improve survival in civilian trauma and to better treat severely injured soldiers in combat. The Department of Defense has an additional regulatory agency to ensure that subjects are protected in this study. This study is different because it involves enrolling patients that cannot give consent, and the treatment must be given immediately after injury. People who are eligible for the study will be enrolled without their consent unless they have selected the opt-out option. In order to do this study without initial consent, we must obtain feedback from the community and inform the public of this proposed research study before the study will be approved or started. Subjects will be enrolled into the study without their consent unless they have an opt-out item that can be easily seen. Death from uncontrolled bleeding is responsible for more than 40% of civilian traumatic deaths and over 80% of military traumatic deaths. 33% have arm and leg injuries, 50% with chest and abdomen injuries, and 20% with groin, neck, and shoulder injuries. We need to find a better way to treat these patients. The medical community realizes that trauma research is important since trauma is the leading cause of death in Americans from ages 1 to 44. Statistics show that more than 160,000 people die from trauma each year, and many of these patients die because we cannot reverse the effects of coagulopathy or severe bleeding and trauma. In comparison, heart disease caused almost 600,000 deaths in the U.S., and influenza and pneumonia caused almost 54,000 deaths. Coagulopathy is a problem with the body's blood clotting process and can lead to major blood loss after trauma. Over 1/3 of severe trauma patients arrive to the emergency department with defective clotting. This can happen if the factors needed to clot are used up. The best treatment for coagulopathy is to give clotting factors, which are found in plasma. Based on the Advanced Trauma Life Support Guidelines written by the American College of Surgeons, the current standard of care for trauma patients is to first start giving normal saline or sterile salt water through the veins, either at the scene or in the ambulance. When the patients arrive at the hospital, they are evaluated, and if they are bleeding excessively, they are given red blood cells and then plasma. Blood is made up of red blood cells, white blood cells, platelets, and plasma. Red blood cells are the part of blood that carries oxygen. White blood cells fight infection, and platelets help form a clot. Plasma makes up the majority of your blood volume and is the liquid portion of blood that has no cells. It contains many proteins that help you clot to stop bleeding. These proteins can be used up in a severe traumatic injury, making it hard for your body to clot. Plasma also helps to maintain the blood volume and supports your blood pressure. Fresh frozen plasma, referred to as FFP, is taken from donors and frozen within 8 hours. Because it is frozen so quickly, there is a limited amount of it available. This study is using a type of frozen plasma called ABFP24, which means it is frozen within 24 hours. The AB stands for the universal blood type. This means that the plasma and the patient's blood type do not need to match. ABFP24 is almost the same as type ABFFP. There's smaller amounts of a few specific proteins, such as factor 5 and 8, that help your body clot. This matters for patients who need those specific proteins, but ABFP24 still works for trauma patients who need the clotting proteins after severe injury. The donors for ABFP24 are pre-screened with strict rules by the FDA. The ABFP24 is tested to decrease the chance of spreading bacteria and viruses in the blood, such as HIV and hepatitis. The FDA also regulates how the ABFP24 is processed and stored. Plasma is given in actively bleeding trauma patients in the emergency department and hospital. Plasma provides the clotting factors to help slow or stop bleeding and is often given with red blood cells. It can also improve blood pressure since it increases the blood volume. Giving plasma early may decrease the amount of blood products transfused and in the end, improve survival and prevent organ failure. The purpose of this proposed research study is to see if giving thawed plasma earlier in trauma patients will help stop bleeding. Usually, we give trauma patients plasma in the hospital, but we want to see if giving plasma in the ambulance will help to slow or stop their bleeding. Patients that are severely injured will be enrolled if their blood pressure is too low and heart rate is too high. Once the heart rate and blood pressure are at a certain point, the patient will be assigned to the standard group or the experimental group at random. The experimental group will be given ABFP24 earlier and closer to the time of injury as one of the initial fluids to be given through the veins. The rest of the care for the experimental group will be the same as the standard group, including the need for red blood cells and additional plasma transfusions. The difference is that the experimental group will be given ABFP24 as one of the first treatment fluids as close to the injury time as possible. As you can see, the standard group will receive the standard treatment of trauma. They will receive saline in the field, red blood cells in the hospital, and then ABFP24, in that order. Here, the saline is the first fluid given in the veins. The experimental group will receive the same thing, but in a different order. The ABFP24 will be given first in the field, then the normal saline. Red blood cells and more ABFP24 will be given as needed in the hospital. After you are enrolled in the study, we will continue to collect blood samples through day 7 after your injury with your permission. The laboratory tests done as part of this study are the same for both the standard and experimental groups. We will collect blood samples up to 9 times during your hospital stay. Leftover blood samples will also be stored for use in future research. You may also withdraw from the proposed research study at any time. Your name and demographic information, including age, sex, ethnicity, address, and phone number, will be collected in this study. We will also use portions of any previous and current medical records that are related to this study, including to, but not limited to, diagnosis, history and physical, laboratory or tissue studies, radiology studies, procedure results, and clinical measures. There is a 1 in 4 chance of dying based on the heart rate and blood pressure measurements used in this study. The benefits of giving ABFP24 early in the treatment period could include an increased possibility of survival. There may be less bleeding since the important clotting proteins are in ABFP24, which may reduce the need for transfusion of blood products, including red blood cells and additional ABFP24. Plasma may also reduce the risk of organ failure and improve survival. Potential risks of ABFP24 include immune reactions such as rash, fever, allergic reactions, transfusion-related lung injury, other reactions, and transferring of bacteria and viruses in blood such as hepatitis, HIV, and malaria. The risk of getting hepatitis B is 1 in 282,000. Hepatitis C is 1 in 1.1 million. HIV is 1 in 1.5 million. And the risk of malaria is 1 in 4 million. There is also a chance that ABFP24 does not improve survival. Patients that may be included in the study are people who have severe injuries after a traumatic event, such as a car collision, and have lost a large amount of blood. Since our paramedics received training about the study, only people transported by Denver Health Paramedics to Denver Health Medical Center will be enrolled. To see who has had trauma this severe, we looked at our trauma registry, a database of the trauma patients that come to Denver Health. From January 2009 to September 2011, we had over 5,300 trauma patients, and 122 of them were transported by Denver Health Paramedics and could have been enrolled. Of the 122 that met the enrollment criteria, 78% were male, with an age range of 18 to 80 years, with an average age of 38. 51% were white, 26% were Hispanic, 13% were Black, 2% were Native American, and 8% were other. There is a less than 1 in 10,000 chance of enrollment each year within Denver. This may increase with riskier behaviors. This proposed research study can be done with an exception from informed consent or without patient consent. A federal mandate was created in 1996 allowing certain emergency research without consent. If it is a life-threatening situation that needs urgent treatment, if patients cannot give consent because of their condition, and the treatment must be given before a family member can be contacted. If the treatment being studied must also possibly help the patient, and if the study cannot be done if a consent is required. This study requires approval of the FDA, the Food and Drug Administration, the Colorado Multiple Institutional Review Board, which is a group of people not involved in the study whose main purpose is to protect human subjects of any study, and the Department of Defense's Office of Research Protection's Human Research Protection Office. If you are involved in a trauma, you may not be able to tell us if you do not want to be in the study. There are 2 ways to let the study staff and paramedics know you do not want to be in the study. They are a bracelet and a necklace ID that says no combat study. We recommend you use both methods. If we see a power of attorney card that states that you refuse products, we will not enroll you. We still encourage you to use the bracelet and necklace ID to maximize the ability of the study staff to know your wishes. We cannot guarantee that your wallet will be with you when you arrive in the emergency room. If a family member is present at the scene and not severely injured, easily accessible to paramedics, and the patient is not in immediate danger of death, the paramedics will ask the family member if there is any objection to enrollment by saying, "We are going to enroll him or her in a research study where we are giving a blood product. We don't have time to explain the study at this time. Is this okay?" The paramedics will not be able to look for a family member amongst the crowd of bystanders because of the importance of transporting the patient back to the hospital as soon as possible. The chance that paramedics will be able to ask a family member for permission at the scene of the accident is low, given the life-threatening situation. We want to stress the importance of using all methods of refusal to notify the paramedics and study staff. If you have any questions or comments about the combat study, please call the Denver Health Medical Center at 303-602-3795. Thank you for your time.